Good morning. I am Dr. Sayali Bogum. I am a consultant gynecologist from Apollo Spectra Hospitals. Today we are going to discuss about a very rampant and growing problem, that is PCOS. It is known as Polycystic Ovarian Syndrome. This is basically a multifactorial, multi-organ disorder which is caused due to a lot of hormonal imbalances in our body. It is growing so rapidly, so that's why we should be aware of all the signs, symptoms and diagnosis and treatment of this problem. This was first discovered in 1935 by Steen-Leventhal in London. Since then, it is also called as a Steen-Leventhal syndrome. Prevalence of this disease is growing all over our country. In adolescent age group, it contributes to around 5 to 15% of all the adolescent girls. In reproductive age group, that is around 15 to 14 years, it contributes to almost 36%. That means every 1 is to 5 women in our country is having this problem. Now we will see about the etiology, that is, what are the reasons behind this problem. There are main 4 to 5 reasons for this etiology. The first thing being the genes. That is, this problem runs in families. It is hereditary. Some of the females who are having this problem can also have in their families, like their mothers, sisters, aunts are also seen having this problem. Second is, it is the main reason is insulin resistance. Now, what is this insulin resistance? Other conditions like obesity, people taking various medicines for diabetes, thyroid are likely to develop insulin resistance. Because of this insulin resistance, there is a hormonal imbalance in our body which ultimately leads to this polycystic ovary condition. And the most important thing nowadays is growing is the lifestyle changes. Lifestyle changes that includes lack of exercise, improper diet, improper sedentary lifestyle, the food habits and the lot of stress which people are facing nowadays. This is the major reason for developing this cause of PCOD. Another thing which is nowadays which cannot be judged but it is growing really hazardly in our society is psychological causes. Psychological causes are there from the growth of a girl. That means whenever she comes in puberty, like 10 to 12 years, she is facing lot of psychological problems like stress in the schools, exam pressures, which may develop anxiety and depression in these girls. And ultimately, it affects the hormones in her body, and this leads to the condition in PCOD. Now, we will see what happens exactly in PCOD. The main reason, there are some hormones which are released in girls and boys, that is males and females after puberty, which are released from the brain, that is from the hypothalamus, and they reach the anterior pituitary, and then they are released on the female reproductive organs. Now first we will see about the females. In females, hypothalamus releases a hormone which is known as the growth hormone regulating hormone. It acts on the anterior pituitary to release certain female hormones like estrogen and progesterone. These are the main female hormones in the body. These female hormones, they act upon the female reproductive organs, which are uterus and ovaries. These hormones, in the presence of these hormones, normal ovary produces some follicles from day 2 to day 12 of the menstrual cycle. After that, from day 12 to day 18, these dominant follicles, they rupture. That is called as the ovulation. After ovulation, there are certain changes in the ovaries and the uterus which results, if the pregnancy is not there, then the girl will automatically get her cycle after 14 days of ovulation. But in case of PCOD, what happens is there is a predominance of male hormones in the body. and there is decreasing or less amount of female hormones. So because of the rising amount of male hormones, the girl produces a lot of cysts, which is called as a polycystic, a lot number of follicles in her ovaries, which do not ovulate, and as a result she doesn't get her periods regularly. So which are these male hormones which are excess? These male hormones are basically androsterone and testosterone, which are present in the males. These hormones are present in very few amount in our body naturally, but in some, due to some imbalances, there is a loss of balance between the male and female hormones, and as a result the amount of male hormones increases and the female hormones decreases. So this results in the excess amount of cysts in her ovaries, and this condition starts developing. So even if there is no hereditary cause in a girl for PCOD, there can be imbalance occurring, as I said, because of the lifestyle changes, because of insulin resistance, and psychological causes like stress, which can lead to hormonal imbalance, and the condition can start developing at any age group. Let's move on to the symptoms of this condition. Now, the symptoms of PCOD, each and everyone should evaluate their bodily structures, features, and we should be aware if we are facing such kind of symptoms in our body. We have divided these symptoms in adolescent age groups, in reproductive age groups, and in women more than 40 years. First, we will see the symptoms which are occurring in adolescents. In adolescent girl, after they start their menarche, after they attain their puberty, they will be having irregular periods with lot of pelvic pain and lot of heavy menstrual bleeding. Along with that, they can also face the symptoms like acne, hirsutism, bloating of abdomen, central obesity, and excessive weight gain, hirsutism, acne, and other mental changes. They can be really rigid, they can get irritable sometimes. So these are some of the symptoms of PCOD occurring adolescents, which you should titrate to your body. In reproductive age group, that is from 18 to 40 years, many females, along with overweight, imbalance, they also face major problem, that is infertility. Infertility is the inability to conceive even after 1 year of having regular intercourse. This is called infertility. Now, if we see the causes of infertility, PCOS results in 70% of the causes. So, out of 10 women who are having infertility, 7 women will be having the problem of PCOS. So, such is the problem and gravity of this situation. Along with infertility, if by chance a woman conceives, she can also have other risk factors like multiple abortions, preterm birth, recurrent miscarriages, and preterm deliveries. And sometimes even the baby might have some physical or mental abnormalities if the mother is having PCOS. So it is very important for all the women in reproductive age group to consult a gynecologist and take proper treatment. Now, even if a lady is conceived, she has number of babies and her fertility is complete, but even if she is having PCOS, after 40 years she might develop certain other problems. So PCOS is a very high risk factor for women who develop hypertension, thyroid, diabetes mellitus, endometrial cancer, and other mental disturbances. So it is very important to treat PCOS at any age group. Now we will move on how to diagnose this PCOS. As I earlier told you, the basic feature of diagnosis of PCOS is that they are the symptoms. So on the basis of symptoms, we all can assess ourselves in the reproductive age group or adolescent or more than 40 years, if we are having the respective symptoms, we can be cautious if we are facing the problem of PCOS. So as I told you, the symptoms which are commonly there are which are detectable by each and every woman are irregular periods, menstrual cramps, acne, hirsutism, infertility or other problems. But some problems are we are unable to judge the symptoms. These symptoms which are unable, they are like anxiety, depression, stress, frequent mental irritability, getting hyperactive or in very low at times, or even getting headache, constant headaches, increasing weight in spite of doing diet and exercise is also a very important feature of PCOS. We feel that we are doing our lifestyle very regularly, but still we are not happy. Sometimes the women are under constant depression, or they are unhappy all the time, or there is something they are feeling is not good in their body. So if anyone feels such, they should consult the gynecologist regularly and take the proper treatment. This is about the symptoms. So if and other things which are there for accurate diagnosis of PCOS are the ultrasonic evaluation. Ultrasound is the best modality for diagnosis of PCOS. In ultrasound, we can detect normally if we see the TVS is the best modality than abdominal scan. In TVS, a normal ovary will have 2 to 3 follicles at a time. But in PCOS, we can see more than 8 to 10 follicles in each ovary. They are arranged like on the periphery of the ovary, and there is central thickness in the ovary that is called stromal thickness, and on the side periphery of the ovary we can see a lot of number of small follicles which are on the size of 8 to 10 mm. So if a woman in ovary sonography scan is having more than 8 to 10 follicles per ovary, we can diagnose her as a PCOD according to the Rotterdam's criteria. This feature of ovaries is called as the string of pearls, because we can see a lot of follicles arranged in the periphery, and this is the classic feature of PCOS. Along with ultrasonic evaluation, we can also judge PCOD depending on the hormonal tests. Now these tests each and every woman should do at least every 2 to 3 years in her lifestyle. This is very important for early and accurate diagnosis of PCOS. There are some basic tests as well as special tests. Basic tests include complete blood count, thyroid evaluation, that is TFTs, the urine routine, and sugar evaluation. Sugar evaluation includes BSL fasting, PP, and HbA1c, which is a major criteria for diagnosis of insulin resistance. There are certain special tests which are used for diagnosis of PCOD. It includes FSH, that is follicle stimulating hormone, LH, that is luteinizing hormone, and prolactin. These home tests definitely assess the hormonal imbalance in our body, and we will be accurate in diagnosing PCOS. Along with that, if a woman is having infertility, then another special test which needs to be done is the AMH. This test is very important to diagnose the severity and the level of PCOS in her body. AMH is known as anti-mullerian hormone. This test, the normal value is between 2 to 4. If a woman is having PCOD, this value can be anything more than 4. So depending on the value, if it is between 4 to 10, we called it mild PCOD. If it is between 10 to 15, we called it as moderate PCOD. But if this AMH value is more than 15, this is called as the severe PCOD, which requires a lot of treatment and management. So I think the etiology and diagnosis of PCOD is quite clear. Now we will move to the management of PCOD. Management of PCOD is a combined approach for a doctor and patient. From the patient side, patient has to do certain things like lifestyle management and diet is very important from patient side of view. In lifestyle management, the patient should do a regular exercise which can include anything for 40 minutes. You should do compulsory daily exercises for 14 minutes, for 40 minutes. This can include anything like aerobics, jogging, cycling, etc. And along with that, you should also do yoga and meditation. Yoga definitely helps to make the hormonal imbalance. It reduces the hormonal imbalance and reduces also the stress and anxiety. Along with that, there are some regarding diets, there are some do's and don'ts. Then in what healthy diet we should apply is we should have more protein rich food, fruits, increase the fiber content, green leafy vegetables, and the most important is increase the water content. Every woman should have at least 3 to 4 liters of water every day. And the things we should avoid in diet are aerated drinks, junk food, having fatty foods, red meat, sweets, and aerated drinks like alcohol and other beverages. In medications, one important thing is earlier they were used to give OC pills for treatment of PCOD. But please remember, this is a very temporary method and it does not improve any cause of PCOD. So now there are many newer drugs which you can get from your gynecologist, which includes vitamin D3, supplementation, myoinositols, dechiroinositols, antioxidants, which will definitely help to reduce your PCOD to almost 80 to 90%, but permanently. So please consult and take proper medications. Along with that, please have stress management in your life. In that, you should take adequate sleep for at least 6 to 7 hours. Do certain hobbies, pursue your hobbies, eat properly, have a healthy lifestyle, and please in some time assess your body whether it is proper. So with proper diagnosis, proper management, you can definitely cure your PCOD problem and mask over it. So I really thank you all for have a patient listening. We will definitely come with other videos, much more videos regarding this and in all other problems. By that time, take care, be happy, be healthy. Thank you.